Your blood sugar is not the problem. It is the alarm. And most people over 60 are being treated for the alarm while the fire keeps burning underneath. If you are in your 60s or beyond, and you have been told your blood sugar is a little elevated, or that you are pre-diabetic, or that you simply need to watch what you eat, and yet nothing you do seems to actually move the needle, I want you to know something important before we go any further. You are not failing. You are not weak, and you are certainly not imagining it. The explanation you have been given is incomplete, and an incomplete explanation leads to incomplete solutions. I have watched this exact story play out for over 2 decades in my practice. A patient walks in, usually frustrated, sometimes embarrassed, occasionally defeated. They tell me they have cut out sugar entirely. They are walking every single day. They have switched to whole grains. They have given up dessert. They are doing what they were told. And their numbers barely move. What I tell them next almost always surprises them. The issue is not willpower. It is not discipline. And it is not even mostly about what they are eating. The issue is something called insulin resistance, a fundamental breakdown in your cell's ability to hear the signal that insulin is trying to send. And after the age of 60, this process accelerates in ways that most physicians simply do not take the time to sit down and explain. Here's what is actually happening inside your body, and I want you to picture this clearly. Imagine insulin as a key. Your muscle cells and your fat cells are rooms with locks on the door. In a healthy body, insulin, the key, slides smoothly into the lock, the door swings open, glucose enters the cell, gets burned for energy, and your blood sugar comes back down to normal. Clean, efficient, balanced. Insulin resistance means the locks have rusted. Insulin is still there, your pancreas is still making it, sometimes making even more of it than normal, but the key no longer turns cleanly. The door does not open the way it should. Glucose stays stranded in your bloodstream. Your pancreas panics and floods the system with even more insulin, trying to force the door. And your body runs under that sustained pressure for years, sometimes quietly, without dramatic symptoms, until the system begins to break down visibly. That breakdown shows up as fatigue that sleep does not fix, weight gain that parks itself around your midsection and refuses to leave, brain fog in the afternoons, blood sugar readings that trend upward no matter how careful you are, and eventually, if nothing fundamentally changes, a diagnosis of type 2 diabetes. What makes this particularly difficult after 60 is that several biological shifts happen simultaneously. Muscle mass declines, and muscle is your body's primary site for glucose disposal. Inflammation increases at a cellular level. Researchers have actually coined the term inflammaging to describe the chronic, low-grade inflammatory state that accumulates with age, and that inflammation directly damages insulin receptors. Hormonal changes alter how fat is stored and how the liver processes glucose overnight. Every one of these shifts compounds the others. It is not one problem. It is a web of problems that all reinforce each other. And handing someone a pamphlet about reducing carbohydrates does not untangle that web. The standard medical system, I will say this plainly, is structured to manage this condition once it crosses a clinical threshold, usually with medication. That is not cruelty. That is how the system is built, around diagnosable conditions and pharmaceutical responses. It is economics and infrastructure, not malice. But what it means in practice is that the years between your numbers are trending up and you now need medication are often left unaddressed in any meaningful biological way. That window, which can be 5, 8, 10 years, is exactly where the most powerful interventions can happen. And that is the window I want to talk to you about today. I am Dr. Everett Cole, a practicing physician with over 25 years of clinical experience. I have spent a significant portion of that career watching patients be handed half answers to whole problems. This channel exists because I believe you deserve to understand your own biology, not in oversimplified slogans, but in real, actionable, mechanistic terms. In this video, I am going to show you one single seed, one that has been studied in peer-reviewed clinical trials at major research institutions, that has been shown to measurably improve insulin sensitivity, reduce fasting blood sugar, support pancreatic function, and lower the inflammatory burden that accelerates this entire process. Specifically in adults over 40 and over 60. And I'm going to tell you exactly how to use it in what amount, at what time, and what to pair it with for the strongest possible effect. But before I do that, I want to ask you one specific question. What was your fasting blood sugar number this morning? Not last month's lab result, this morning's reading, if you have a home glucometer. Drop that number in the comments below. I read every single one, and your number tells me more about exactly where you are in this process than almost any other single data point. If you do not have a meter yet, write down how many of these symptoms you are currently experiencing. Afternoon energy crashes, difficulty losing weight despite eating carefully, waking up tired after a full night of sleep, strong cravings for carbohydrates or sweet foods in the evening. Count them and leave that number. We are having a real conversation here, not a broadcast. The seed is fenugreek, botanically Trigonella phonem graecum. On your grocery store shelf, simply fenugreek, or in South Asian markets where it is extremely common and considerably cheaper, it is labeled methi seeds. It is a small, hard, amber to golden seed, roughly the size of a pea but flattened and angular, with a distinctive, faintly sweet, almost maple-like aroma when ground. It has been a cornerstone of South Asian, Middle Eastern, and North African cooking and traditional medicine for thousands of years. And it turns out that what cooks and traditional healers knew intuitively, that this seed had a stabilizing effect on the body, science has now begun to explain with considerable precision. Let me tell you about a patient I will call Margaret. She was 67 years old, recently retired, and she came to see me with a fasting blood glucose of 138 milligrams per deciliter. That number put her solidly in the pre-diabetic range, close enough to the diabetic threshold that her previous physician had already told her she would likely need to start metformin within the next calendar year. She was scared. She was also genuinely angry, which I respected. She had already overhauled her diet twice. She had lost 11 pounds over the prior 8 months through real effort. She had cut out white bread. She had stopped drinking juice. She was walking 30 minutes 5 days a week. And the number sat at 138 like it was carved into stone. When I explained the mechanism, the rusted locks, the inflammaging, the way age-related muscle loss was reducing her glucose disposal capacity, something shifted in her face. She said, "Nobody ever explained it like that before. They just kept telling me to eat less sugar." We talked about fenugreek as one tool within a broader approach. She was skeptical. She told me directly that it sounded like something from the back pages of a health magazine. I showed her the studies. She committed to a consistent 12-week protocol. At her follow-up appointment, her fasting glucose had come down to 109. Her physician, who had expected to write her a metformin prescription that visit, instead took her off the watch list entirely. Margaret is now 71. Her most recent A1C, a measure of average blood sugar over 3 months, was 5.6, normal range. She still checks in occasionally. She calls fenugreek her morning ritual. What changed was not magic. What changed was mechanism. Now, before I walk you through exactly how fenugreek works inside your body, if you are watching this and thinking, "Why has no one ever told me this before?" That is exactly why this channel exists. I put out videos like this every single week. No products, no sponsorships, just the biology your doctor does not have time to explain. Hit subscribe and turn on the bell right now, because the next video in this series covers something even more surprising, and you do not want to miss it when it drops. What fenugreek actually does inside your body, and why it works specifically after 60. The first and most significant mechanism is the fiber. Fenugreek seeds are extraordinarily high in a specific category of soluble fiber called galactomannan. When galactomannan contacts liquid in your digestive tract, it forms a thick, viscous gel. Picture honey slowly spreading across a surface, rather than water rushing down a drain. That gel physically coats the lining of your small intestine and dramatically slows the rate at which glucose from your food is absorbed into your bloodstream. Why does this matter so much? Because the damage of blood sugar does not come only from the level, it comes from the spikes. A rapid, sharp rise in blood glucose forces your pancreas into an emergency response, flooding insulin into the system. That repeated emergency signaling, over months and years, is what wears down receptor sensitivity and deepens insulin resistance. Galactomannan essentially converts a spike into a gentle slope. The glucose still arrives, but it arrives slowly, over a longer window, in amounts your body can actually manage. Smaller rises, smaller insulin responses, less strain on the already struggling locks. The second mechanism is even more specific. Fenugreek contains a unique amino acid found in very few other foods called 4-hydroxyisoleucine. This compound has been shown in multiple studies to directly stimulate pancreatic beta cells, the specialized cells in your pancreas responsible for producing and releasing insulin, to function more appropriately in response to rising blood glucose. It does not simply stimulate more insulin production. It improves the precision and the efficiency of the response. The key, in other words, begins to turn more cleanly. The third mechanism is the one that matters most for people over 60 specifically. Fenugreek has documented anti-inflammatory properties at the cellular level, working through pathways that reduce NF-κB signaling, one of the primary molecular switches for inflammatory gene expression in the body. Remember the concept of inflammaging, that chronic, age-related elevation of baseline inflammation that degrades insulin receptors over time. Fenugreek works against that degradation directly. It is not simply lowering a number. It is addressing one of the root causes of why the number keeps climbing. What the research actually says, specifically. A landmark study conducted by researchers at the All India Institute of Medical Sciences followed type 2 diabetic patients who consumed 25 grams of fenugreek seed powder daily over a 24-week period. Fasting blood glucose dropped by an average of more than 30 milligrams per deciliter. Glucose tolerance, the body's ability to clear blood sugar after eating, improved significantly. Triglycerides fell. LDL cholesterol showed meaningful reduction. A separate randomized controlled trial, published in the Journal of Diabetes and Metabolic Disorders, examined adults specifically in the pre-diabetic range. Participants who used 10 grams of fenugreek seeds daily showed a significantly reduced rate of converting from pre-diabetes to full type 2 diabetes over a 3-year follow-up period compared to the control group. Not just improved numbers on a lab report, fewer people cross the diagnostic line into disease. That is a clinically meaningful outcome. A 2019 systematic review in phytotherapy research analyzed 12 separate clinical trials on fenugreek and glycemic control. The conclusion was consistent across populations and study designs. Fenugreek significantly and reliably reduces both fasting blood glucose and post-meal glucose response, with the most pronounced effects observed in individuals who already have established insulin resistance or confirmed prediabetes. That is precisely the population watching this video. This is where most people go wrong. They buy fenugreek tea from a wellness brand, drink it a few times, feel nothing, and conclude it does not work. Tea contains almost none of the active fiber. You need the seeds themselves. The effective dose established in clinical research is 10 to 15 grams of whole fenugreek seeds per day. That translates to approximately 1 to 1.5 tablespoons. Start at the lower end. Whole seeds or coarsely ground seed powder are both effective. Capsule extracts at low standardized doses are not equivalent and consistently underperform in research compared to whole seed preparations. The preparation method matters. The night before, place 1 tablespoon of seeds in a small glass and cover them with about half a cup of cool water. Let them soak overnight, a minimum of 8 hours. In the morning, drink the soaking water first. It is rich in dissolved galactomannan. Then eat the softened seeds directly, or stir them into yogurt, blend them into a smoothie, or mix the ground version into warm oatmeal or a glass of warm water with a squeeze of lemon. Some of my patients grind a weekly batch of dried seeds in a small coffee grinder and keep the powder in a sealed jar for convenience. Timing is not optional. It is central to the mechanism. Take fenugreek approximately 30 minutes before your 2 main meals, or at minimum before breakfast. The gel needs to be forming in your gut before the carbohydrates from your meal begin to arrive. If it is already there waiting, the effect is dramatically stronger than taking it alongside or after food. The single most powerful pairing I recommend is a short walk after meals, even 10 minutes at a comfortable pace. Here is why. Skeletal muscle has the ability to absorb glucose through a pathway that does not require insulin at all, activated directly by muscle contraction. Fenugreek slows the flood of glucose entering your blood. A brief post-meal walk helps drain it through a completely separate channel. These two tools working together consistently outperform either one alone. That combination, seed before the meal, walk after, is the core of what I discuss with patients who are serious about reversing this trend. One practical note: begin at 5 grams for the first week. Introducing a significant new fiber source too quickly causes bloating and digestive discomfort in some people. Your gut microbiome needs a short adjustment period. Increase to the full dose in the second week. The safety conversation, because it matters. If you are currently taking any medication to manage blood sugar, metformin, glipizide, glyburide, or insulin of any kind, please have a conversation with your physician before beginning this protocol. Fenugreek can enhance the glucose-lowering effect of these medications, which is not inherently dangerous but does mean your blood sugar could fall lower than your current medication dose was calibrated for. This is manageable. It is also, frankly, a good conversation to be having with your doctor, because if your blood sugar improves enough that your medication dose needs to be reconsidered, that is a win worth managing carefully. If you are on blood thinners of any kind, note that fenugreek has mild antiplatelet properties, and that is worth mentioning to your prescribing physician as well. Insulin resistance after 60 is not a single malfunction. It is 4 separate processes degrading in parallel. Your cellular locks are damaged by chronic inflammation. Your pancreatic beta cells are overworked and losing precision. Glucose enters your blood faster than your body can respond, and years of hormonal disruption have shifted your metabolism toward fat storage rather than fat burning. Fenugreek directly addresses 3 of those 4 simultaneously, slowing glucose entry, improving beta cell signaling, and reducing the inflammation that is driving receptor degradation. As those 3 stabilize, the 4th, the hormonal environment, begins to shift naturally in response. Lower, steadier glucose levels mean lower, steadier insulin levels. And lower insulin, sustained over weeks, is what allows cells to gradually rebuild their sensitivity. The locks begin to clear. This does not happen in 3 days, but in 8 to 12 weeks of consistent daily use. Both the clinical research and my own experience with patients show changes that are real and measurable. Your action plan, starting tonight. 1. Find fenugreek seeds today. Any large grocery store, any health food retailer, or any South Asian grocery store, where they will be labeled methi and cost very little. You want whole seeds or coarse ground powder. 2. Tonight, soak 1 tablespoon of seeds in half a cup of water and leave it on your counter. Tomorrow morning begins the protocol. 3. Drink the soaking water, eat or blend the softened seeds before breakfast, and take a 10-minute walk sometime within the hour after eating. That is the complete starting protocol. It takes less than 3 minutes of active effort. 4. Write down your fasting blood sugar today if you have a meter, or note which symptoms you are currently experiencing. A baseline you record is a change you will actually be able to see and believe when the numbers shift. 5. Stay with this channel. The next mechanism I want to walk you through is something almost no one explains properly: what insulin resistance does specifically to your liver overnight, while you are sleeping, and why some people wake up with higher blood sugar than when they went to bed even without eating anything. It is a strange and counterintuitive process, and once you understand it, a great deal about why your mornings feel the way they do will finally make sense. I will see you there.